Welcome to Health Impressions, the show about authority, acquisition, and retention. I'm your co-host, Bryan Cush, co-founder of Tidal Health Group, a digital marketing agency specializing in healthcare. I'm accompanied by Jay Parkinson, Chief Medical Officer of Sana, a health plan that delivers high-quality healthcare while keeping costs down. Our show focuses on the cross-sections of marketing, patient experience, and product development. We explore strategies for providing high-quality care, enhancing patient experience, and retention through cutting-edge technologies. We'll be speaking with like-minded industry leaders who will be sharing their learnings and spilling some secrets too. Jared, welcome to the show. It's such a blast for you to be here. I've been lucky enough to be a guest on your shows, lucky enough to bump into you in conferences, even lucky enough to introduce you to Jay in person at conferences. So it's great to finally have you on. Really welcome to the show.
Bryan and Jay, it's a pleasure to be here. Thanks for the invite.
I've seen you part of so many conversations around this topic, so I think we're going to steer in many different directions. And I feel like this is a softball that can get knocked anywhere. But I just love to how do you even begin to start to think about making consumer-centric experiences in healthcare?
Yeah, well, you know what's funny? It sounds like a softball question, and there's actually a lot of different directions you can go with it. Where I like to start is always just setting some context for the consumer discussion in general, right? I mean, we're all still at different levels or different stages along the spectrum or this journey of being more consumer-minded. And I don't know that we have the full destination yet, but it's helpful for everyone to at least start at a closer starting point, right? And the main things that are happening, the main evolutions that have happened in healthcare are that consumers don't just have choices, they have expectations. Back in the day when the word consumerism was first kind of being minted or coined out there, we talk about it how consumers have choices now, for a lot of different types of care. And I feel like that has evolved to say, now they have expectations. And that's a whole different layer to what it means to address those, to acknowledge them, to address them, to have it be part of a care journey. And one of the reasons for that is that consumers are demanding an experience that more aligns with their expectations. And that wasn't always the case. We didn't always know that, first and foremost, that we had certain choices and that those choices would either be a more complicated experience or a simpler experience. But what we're learning is as more types of traditional and non-traditional organizations are offering some kind of care, that does change our expectations. The pandemic changed our expectations about things in general, about life and how simple and how less complicated things could be. And as an everyday person, the definition of a consumer, right, is somebody who isn't necessarily being actively seen by a healthcare professional at that point in time. I'd like to think, I don't like to get too caught up in the wording, but I think it helps to set up a discussion because a lot of healthcare leaders can get caught up in they're not a consumer, they're not a customer, they're my patient. And there's a lot of value to that. And what I like to say is it's not taking away from the dignity of patient care to acknowledge that somebody is having life happen during the time that they're not being actively seen by a healthcare professional, right? So there's a lot of things that happen in our lives that affect our health choices that aren't just happening from the time that you'd consider it yourself being a patient. And so it's a tricky line to walk there, but I think that's kind of the starting point for the conversation about what to do with the consumer experience, how to improve it, why it matters, is because consumers are demanding something. Their expectations have changed. They're demanding something that aligns with those expectations. And they're seeing a lot of non-traditional organizations out there offering some type of easier experience, something that we consider more consumer friendly. And so they're saying, well, can my hospital, can my provider, can this be easier? It seems like it's easier over there.
That's interesting. So what do you think, as a traditional provider or a traditional hospital, what do you think's table stakes right now for what consumers expect?
Great question. So they do expect it to be easier to schedule an appointment, and they expect an appointment to be more available. What's the latest stat I saw? And again, the stat is different everywhere. The latest stat that I saw, that the average time to get an appointment scheduled was 26 days, and that was up from 24. That was in 2022. I've seen different stats. It actually seems a little low to me, but that's what the primary care provider, right? So you're like, I hope I'm not still sick in 26 days. So I want to see somebody a lot sooner than that, today, tomorrow. I'll just go to an urgent care, or whatnot, or I'll got to go to the ER. So I think the availability of an appointment is one. I think it's not too much to ask to at least have some greater visibility of what something will cost you before going in. And sometimes that's one of the complex things here. I have to acknowledge that is not just let me throw up the charge master spreadsheet out there like a lot of hospitals have done. That doesn't help anybody, I don't think. To see the whole price list, that can't be done. But can there be a little bit more explanation of an awareness of what something's going to cost before you go in? And then the digital abilities, the options there. Some types of care, I'm not going to want to come in to the provider. If it's a surgical follow up, can I do that virtually? Is it easy to have that virtual visit happen? And is it clear that that's either going to cost this much or it's included? If I'm, I was speaking with a mother of young children pretty recently who, for a follow up appointment, it's about an hour and a half to the nearest to the children's specialty hospital in her area. And for those follow up appointments, she'd have to take off work. She'd have to make that drive. She'd have to coordinate care for her other children just to come in for follow up visits. She's like, "Can I at the time, they weren't offering a virtual option there, so she's like, "Can I?" That would be a perfect time for a virtual visit to happen. So I think just having those things offered, more availability, more access, somewhat more visibility on price list. I'm not going to sit here and say it's possible at this point in time to really be transparent on pricing, but a little bit better of an idea of what it would cost for some of the things.
Yeah, it's interesting in terms of pricing. The way I always think about it is there's kind of commodities and quests. A commodity is like, I need a chest x-ray, right? And
Yep.
that should be really clear. But quests are like, I have no idea what you got. I got to see it before I figure out how much I need to do. And that's probably impossible, you know? At the same time, my poor puppy was in the hospital, a few weeks ago, and that conversation that I had with the veterinarian upon his admission to the hospital was pretty fascinating. It was essentially a line item list that he had pre-prepared prior to the sort of seeing my dog, but kind of knew what was going on. He pre-prepared this list. After we were done talking, he was like, "Okay, here's the list of 30 things we're going to do," and each list line item had a range of prices. So the bottom range was, I think it was 3,000, and the upper range was like 5,000. And he was like, "You good with this?" And I'm like, anything for this golden doodle I have. And that to me was one of the more fascinating ways. I always tend to look outside of healthcare for inspiration. And the vet world is actually a really interesting sort of more cutting edge in terms of like medical services than the human world. So I find that pretty interesting.
It's a really good point. Dental is a lot the same, in terms of you're getting your reminder appointments, you're getting more information that is very
Mhm.
personalized to you just along the way, and in places that now we expect it. So yeah, it's a little
Yeah.
different than it used to be.
Well, it's interesting because like, you started off talking about like the consumer of healthcare. Like I actually have this like, I don't know, probably unpopular opinion that the consumer of healthcare is the doctor. because they're actually the ones spending the money. They're just like, it's basically, they're like going to Amazon, not seeing any reviews, not seeing any prices, and getting to like use someone else's credit card. It's just the patient is this like third party, that is kind of like everything's spent on their behalf, and they really don't have much say, nor, well, they have say, but they don't have much sort of expertise to understand like what to spend. But it's an interesting sort of dynamic to think about, who is actually the consumer of healthcare.
It is, what I've heard that that dialogue before, because you can also make the case that it's the payer, the one who's actually covering the cost of an engagement, encounter, procedure, or whatnot. So there can be a case for that. So again, it's a good use of, do those terms help us understand that there are needs and expectations and choices now that are more apparent and more available than there used to be. So whatever we call that, the person who's seeking care, can we be comfortable with that thought, and not worry too much about the wording? And again, like I've probably been one who's like has gotten stuck on the wording before in the past, and so I've just seen the value of opening up that conversation, however it makes sense to us.
Yeah, definitely.
I have to call out just the parallel lives we must be living right now, Jay, that we didn't coordinate our white t-shirts. And I literally just had a whole episode with my dog at the vet about a week ago. And it was like one of the more pleasant experiences. And it was wild how I had to get in an emergency visit. They pre-held slots for emergency visits, but were very explicit that there's a premium you pay to get in same day. Came in, I have like 10 minutes. They saw the problem, tiered out. They said, here's the $45 antibiotic. Option 1 we're going to take. Here's the option 2. Here's option 3. These are the scales of prices. Tell me where. And literally had the exact same reaction. It was like, great, you've set the expectation. I'm cool with all of this. Do whatever you need to make her better.
But it's wild because, you're the one footing the bill for this. This is, this is going on your credit card. So like there's a different expectation in that world, right? That they should treat you differently, and they should be more sort of, it's like the epitome of the member experience. If you're like the member of that veterinarian's practice, like they're going to treat you like, they need to retain your business. It's very interesting. It's sometimes like the patients are treated in healthcare, medical doctor care, as just like some, necessary third party.
I'm curious both your takes on this. Maybe I toss it to you, Jared, first is, do you still see those table stakes that Jay asked you about as differentiators? It's funny to me. I think that was one of the primary things cited in the One Medical acquisition was the ability to have same day and walk-in appointment availability. Whatever the unit economics was, I forget what percentage they said that they kind of always have same day, but that was cited as a primary kind of value add or a market differentiator. Do we feel that that's still a differentiator, or is that kind of becoming the universal, and then people are thinking further to differentiate?
I would say totally depends on the market that you're in. I've learned how different each local healthcare market is, depending on what those choices are, who's available, what's available. And rural versus urban is different as well. I absolutely think it can still be a differentiator. We are far from those being universally available features or benefits, for lack of a better word. They are far from universally offered. And especially in a lot of rural markets, same day isn't necessarily possible. A lot more virtually than it used to be, but it's still not universal at all. For that average to be still 26 days, I'm sitting here now, admittedly, my primary care doctor for my family is a direct primary care doctor, right? So it's subscription based. It's somewhat similar. I feel like it's a slightly less concierge version of One Medical, but it is subscription based. I can see the doctor as often as I want. I was literally just texting him this morning to schedule my physical for next week. He had availability tomorrow, as it turns out, but I was like, let's do it next week, right? I've never been able to do that with the primary care doctor prior to that. So I, not everyone has the same choices around me. I don't have a Walmart health clinic in Arizona, although they're opening several in the Phoenix area in 2024, right? So it will be here, but I don't have that. I do have a Village MD clinic in a Walgreens, less than a mile from my house. I have 3 urgent cares within a mile of my house. So I feel like I have some things covered, but that's going to look very different to somebody else who doesn't have as much of an option or as much competition, if you will, to make that a priority. And that is not an easy thing to I want to acknowledge the complexity in offering some of these things, right? It's not as easy as like, let's just implement it. It's so different than, implementing Epic, or implementing some new software to make things streamlined. It's like, there's a lot involved in having availability, have less of a wait time. There's a philosophy change. There are operational changes. There's buy-in that has to happen there. So, long way of saying, to me, it still feels very, very conditional based on the market dynamics and what those choices are. I feel in most markets, it probably still can be a differentiator just because we have so far to go.
I think that's an interesting observation. You mentioned like Walmart and Village MD. And I've always thought of it in terms of like, does the doctor's name like come above the brand, or is, the brand above the doctor's name? And so in the past, it was always the doctor who never really worked for a brand. And all of a sudden they're working for One Medical or Village MD, and they're essentially interchangeable now. Like, oh, I get my care from One Medical. They never say like, I get my care from Dr. Smith. He just happens to be at One Medical. So there's this interesting transition that's happened, I think, in the last, I would say 15 years, where doctors are now kind of like no longer a brand. They're just kind of like a, retail worker. Is that something that people you think are going to welcome, or is that, are they going to welcome the like convenience of what the brand offers, or are they more interested in, having that old fashioned doctor?
I think, well, again, don't you hate it when people say it depends? But it kind of does, right? It depends on your personal health situation, right? Are you a family with young children in the home, who it's going to benefit you to be able to say, yeah, we got rashes, we got coughs going on, we got sore throats. What do we need? I don't want to wait 26 days. I don't want to go to the urgent care. I feel like some health situations are going to facilitate the need for a more relationship-based approach to finding primary care. And so some of those, compared to a young, single 25-year-old, living in the city who doesn't have chronic health challenges, may not even see the need for a primary care doctor at all. Maybe they're okay with the convenient every now and then, I just want to check my vitals kind of a thing. It could definitely depend there. I do see for sure that has been a trend of I love the way you put that, Jay, of having the brand above the doctor's name now. And I can see that playing to some people and not others. I mean, my parents would probably rather still have the relationship with their existing doctor versus like, I don't know if they're the most trusting people, right? So they're not going to be like, oh, I'm going to go try something else. They're going to be like, well, Dr. So-and-so has served us well for all these years. We're going to keep going there. It seems like it depends.
Yeah, no, it definitely depends. I guess the question is like, what type of persona would be attracted to the branded doctor over the, personal doctor. So it's, it's none of these questions are answered just yet. I think it's going to have to play out over the next 10 years, but it looks like the brand is going to start winning soon.
Yeah, and I think it's evolving. I mean, Jay, how long ago Sherpa was that concept of a brand at the initial episode of care? And I think that's where the disassociation started. The first was primary care. It's kind of the easiest model to break, to go, well, we can create a brand that people will entry into their episode of care. And then as you went down kind of the more invasive steps of care, it generally then shifted over to the provider. But now you're seeing these entry points, and even clients that we've worked with that have taken slices of specialized care and put a brand there because the consumer of healthcare has become so informed. And as we continue to shift to this retailization of healthcare, people expect to have a consumer experience, which is very generally brand forward. So we're seeing it even move down kind of the episode of care past primary care and entry points kind of along the way. Um, I love that question. It's the one we're always kind of tackling and battling with.
Well, right. Yeah. And that's always based on our own perspective, right? It's really easy to project your personal perspective of the care that you need in your life and just assume that everyone else feels the same way. And this is what I'm trying to work on myself and learn more is, I can put myself in my parents' shoes or my children's or, or colleagues and friends and loved ones. And everyone has a different level of need, a different perspective of what type of relationship they need. Is it more preventive? Is it more hereditary? Is it more chronic conditions? It varies so much. And so it's helping us. I think the conversation has evolved to a better place where we're acknowledging that and not just saying, hey, I'm sure either no one's going to go to the CVS, to the Minute Clinic, or everyone's going to go. It doesn't help us to deal with those absolutes. That's what I like about what you've both said here is that it's helped to recognize the variety of care needs that are out there, because some of those things are going to facilitate a different approach and a different likelihood of going to like the grocery store for your wellness check, right? HEB, grocery chain, I think they're based in Central Texas. They just opened up a couple of more wellness clinics. They have a subscription-based health primary care service. You go to the grocery store, right? I'm like, I don't know if that would be ideal for me, but it might be ideal for somebody else. I don't know. Like they're popping up everywhere.
Well, it's interesting because the concept of the brand has been there for ever since a Baptist hospital in X city became a thing. You know what I'm saying? And it's like that there's always been that brand, but I guess there's just like this next generation of brand that's like independent from the local provider, local hospital system, and I guess that's where the big disconnect is. At the same time, if you look at the numbers, I mean, the hospital brand is destroying these little startup brands. One Medical only has like a couple hundred not even a couple hundred, I'm sorry, like about 150 practices. And like that's chump change for, one of the big systems of New York City. You know what I'm saying? And so it's like the hospital brand is still kicking ass.
Yeah, agreed. And that's an important part of the perspective. I feel like we have to take that into account.
That's probably why a lot of hospital systems don't like even bother with these little startup brands that are kind of like, they're interesting to us, but I think the hospitals are just like, get out of here,
Right.
Yeah.
You talk about this consumer insights department concept, Jared. Can you tell us more about that? Are you seeing brands literally develop these departments, or is that something more aspirational that you're championing for? Both?
There are health systems that have a consumer insights or consumer research team. I'm finding it's not a one size fits all. I'm finding some places it sits within marketing, some places it sits within operations and an experience team, a patient experience team. So I think it's been homegrown depending on who championed it initially. I know of a handful though of organizations that do have that, and it's primarily a market research function that is more than just your HCAPs, your patient surveys. They're trying to take into account more of the factors that happen outside the time that you're being actively seen. And so they're trying to get a better understanding of what points in an experience are filled with friction, where that friction is causing them to either be so frustrated that they're considering switching providers or making another choice in terms of where to seek care. So that's the primary function there, because if in a commonplace traditional setup for a hospital or health system, if you had your marketing team, they were primarily at one point I know it's changed a lot since then. But back in the day, it was just managing advertising. And so it was kind of based on availability and channels and pricing and placements. And it was a lot of spray and pray. And again, it's evolved a lot with digital channels. But if it's seen as a marketing function, then this is what informs and fuels all the campaign messaging, right? And who to send things to, and it facilitates the personalization as much as possible. I'm still not believing that we can have a one-to-one true personalization of healthcare marketing at this point. There are a lot of obstacles to that, and I'm not sure that that necessarily is the goal here. But the teams that I know of who are doing this are actively surveying consumers in their community about not just the patient experience, but things that led up to it. How easy was it to set up your appointment? They're asking other questions, and so it's a combination of qualitative and quantitative research about things that again happened before or after what you're typically being surveyed about, and sometimes that's being done in real time also, which gives you a very different perspective there as well. So I do see it being primarily a marketing slash market research function that drives a strategy, so that you're not sitting there with a disjointed approach to the messaging. You're actually facilitating the the interplay between uh, experience design and marketing, and ideally your digital slash IT team, your dev team, whoever's actively deciding what platforms to build or buy or partner with somebody on, because more often than not now you need that partner in there as well to help enable some of this.
What have you seen out there in terms of a traditional brand that's kind of like nailing it right now?
That is a good question. There are a lot. I mean, there really are a lot. So I feel like Providence up in the Pacific Northwest, based in Washington State, I believe. Um, they've been digital first for a long time. They've been, I think they'd agree, they're Amazon influenced, for lack of a better term. Aaron Martin, their former chief strategy and marketing officer, came from Amazon, and then just um, recently went back to Amazon. So they're definitely influenced. They bring a lot of methodologies there. They're actively trying to invest in and develop platforms that enable a more consumer centered version of things like an identity based encounter that can be transferred to a retail store or somewhere else, that actually all of your information does stay with you and not with the facility. So digital first. I mean, they have their digital innovation group, and they definitely have a consumer minded strategy there. Those guys do a lot of great work. Advocate Aurora, um, they have a foundation that acknowledged right when it was birthed. I can't remember how many years ago, not that many years ago, that some care, if they're focused on the needs of the consumer in their community, not all of those health needs are going to be met by traditional sick care. And so sometimes they were going to need to be able to have the right partner to refer someone out to somewhere else, or partner with community organizations to meet some of those health needs that aren't addressed by active treatment. They're more preventive. They're more ongoing, and that was kind of a philosophically, again, I don't know, I don't have any insight into how successful that is, but philosophically that matches more with the consumer minded approach. Um, yeah, there are a lot out there. Baptist Health South Florida, you just mentioned Baptist earlier, right? um, they're actively working to incorporate a consumer insights um, approach to things. UNC Health, North Carolina, they're doing the same thing. They have a consumer insights team that is housed with, in their case, it's in their marketing department. So I feel like there are players in just about every region here that are acknowledging it and attempting to undergo a larger transformation around a consumer minded approach.
Yeah, yeah. It's interesting how much, like, I think everybody's probably trying to recreate their own wheel. Like, separate from one another, just because, like, it just goes back to the healthcare is not a $4 trillion industry. It's like 100, $4 billion industries, right?
Right.
Or $40 billion industries, right? So it's
Yep.
like everybody's sort of thinking their own little special snowflake. But, like, in a lot of ways, there's a patient, there's a doctor, they got to deliver care. And, there's not really a sort of best practice just yet, because it's like everything is being independently built. And, I think it's interesting what you said about Providence, in that, like, well, they obviously took inspiration from Amazon and said, like, what can we bring from Amazon to healthcare? And it's another example of just like healthcare is never the place that I look at for, like, inspiration. It's always like, again, look at the vets, look at Amazon. Like, how is that going to impact, like, the ideal patient experience? Um, but yeah, it's funny just because it's like, it's really just leadership, isn't it? It's like Providence's leadership acknowledges that there's just almost a lack of leadership across a lot of, like, health systems, uh, that aren't very visionary, I guess. But the ones that are, they're a minority, but they're like, they really stand out. So it's important to call them out for their success.
Well, right. And, I try not to sound like too much like I'm pointing the fingers, right? Like, there's a lot of reasons why it's not that easy for health systems to have evolved and to have created that visionary function that's able to see what's happening on the consumer side. I mean, the whole approach to the mandates associated with the meaningful use of EHRs, being forced on the clinical community. I feel like timing wise, who would be excited in the clinical world to be told, hey, look, now we need to start changing our approach to care. We need to make it
Yeah.
easier to schedule us. We need to be, we need to have all these extra things to do. And I do think it's worth pointing out that if you think about it in a visionary way, a consumer transformation, like the larger scale thing, what needs to happen in our organization to facilitate consumer minded innovation, ideally, if that's being done right, I'm convinced it doesn't have to be, and it shouldn't be done at the expense of the provider. It should not add any burden to a provider. Because a lot of times the provider's experience is actually what improves the consumer's experience. And so, it's a way of acknowledging it and being very aware that this isn't just like another mandated platform that you have to learn to use again. It's not like the EHR era. It is a transformation that should make things easier. A lot of times this is going to be not adding things to processes. It hopefully is taking things, like reducing things, simplifying things. And if that's possible, then hopefully, again, that should be the goal here, doing that without adding any burden to the provider. And I know that's not easy, but that should be part of the awareness and part of the goal. And I do think that it's worth mentioning just because it can be easily construed as what else do I have to do now? And rightfully so.
Yeah, I'm curious. In one of the systems you referenced, I forget which one, that their differentiator was that they were owning the consumer's experience, even when it was care that they couldn't provide under their own hood. And it's funny, like the first thing I thought about was that's Miracle on 34th Street. Like that was the sales philosophy. If you remember that movie, that when they brought Chris Kringle in, was like, no, we just need to meet our customers' need. Was like, even if we don't have this product, or it's not in stock, or we don't sell it, let's already have a pre-vetted list on where to send that person to kind of solve their problem. And the whole kind of philosophy of that was that it increased just the trust of the brand. And what's really interesting in healthcare to all of this is like, that's a very low lift. Like there's no technology implementation. There's no cost to that. I'm curious, like your view on that. What does that do to brand loyalty within healthcare? Is that an area to focus on?
Well, I'll attempt to explain from my point of view rather than Providence's. Because hopefully I represented their approach right. I'm pretty sure. But from my point of view, my question would be kind of taking a step back from there and saying, how do we know what brand loyalty looks like right now from a hospital or health system? how do we know that patients are actually as loyal as we think they are to staying within our health system for all of our health needs? I'm not convinced every provider organization has their finger on that pulse, that sometimes we can overestimate what that is, because, hey, look, we've been in the community for 100 years. We've been providing these needs, these services for all this time. I'm sure we have loyalty. I guess it's answering a question with a question. I'm being very difficult today. But that's where my mind goes on that one, because if that's the case, are we acknowledging? I do think this is where Providence has gone with this line of thought is, if consumers are going to have more expectations and make choices not as often based on brand loyalty as we used to think. In other words, if there is an easier path to take care of some of their needs, will they take it more often? Do we just accept that and figure out really what you change your entire approach to, from a marketing standpoint, activating new patients, retaining them, keeping them within your brand? You approach it very differently, as opposed to thinking, hey, we've always had their loyalty, and these other non-traditional folks who are offering things, retailers and digital health startups, we don't have to worry about them. That's just going to not make much of a dent. And it's possible it might not make that much of a dent. It's just recognizing that that's a different approach, and it's either accepting that as a reality or not, and that would change your approach to how you attempt to keep people more loyal to your brand.
No, I love that. It makes me think, and even Jay's reference before, the commodity versus quest. And it's something we've always been preachers of, especially on the quest side, is care can be very complex, but that patient will remember who helped them ultimately solve their problem, even if it wasn't you, the individual provider. And that creates even a brand loyalty to that referring individual or practice or external brand that you ultimately did right by that consumer and that patient. And I don't know, I love that analogy, and it seems like a very low lift entry to shifting more towards a consumer forward mindset.
I do have one question that I'd love your take on. Healthcare is often super episodic, and there's a lot of like downtime in between those episodes. How does a healthcare brand stay relevant in those downtimes? Have you seen any sort of best practices or interesting approaches to staying top of mind?
Well, I won't say TikTok, but no, that could be. What is it? Threads now too, right?
Yeah, insert threads.
Yeah. I'm being facetious, right? But short answer is, I've always felt like providing engaging, relevant health information in a way that the people are already engaging, that they can passively consume. There is a lot of value to that still. That said, that is one of the hardest things like a marketing team can do, or a clinical team can try to do, is try to do that, because everyone's needs are so different, and all the privacy laws and regulatory laws associated with the data that you get from primary sources, as well as any marketing partners you have. It's not easy. So there's so much nuance in that as well. But if you're able to deliver on that, if there's content that's engaging, and again, that's not easy either. I feel like people can sniff it out a mile away these days. And if something isn't as engaging as something they're seeing on social media, then they might not engage with it as much. So that's one way.
It's interesting because it's like, do local hospital networks now, or do they look at their like competition as like Goop or something like that in terms of like engaging health content, right? So should a hospital become like a more sort of medical Goop? Are they trying to, or is anybody even really experimenting with like really good content, or is it mostly just like green smoothie recipes?
Oh, I've seen there are a lot who are miles ahead, I feel like, here, that do know what they're doing with content, and are providing it in an engaging way. again, it just takes it takes a lot of reps to get good at that.
Yeah.
Jared, it's always a blast to reconnect with you. Appreciate your time. Appreciate all your experience. Anywhere that's kind of best for people to connect with you, where you're maybe most active online as well?
Definitely active on LinkedIn. The podcast is called Healthcare Rap. We publish every week. We've been doing that for over 5 years, and just love that as an opportunity to engage with people who are doing things a little different, or ways for us to understand what's happening out there in the consumer side of disruption that impacts those everyday health choices for us as people. There's a lot that goes on inside and outside of the traditional healthcare system, and so we're always trying to understand why is that brand doing that, that kind of thing. So we'll invite people on there. But yeah, those are probably the easiest places to find me. And thanks again for inviting me here. It's been a blast. I'm glad we could solve all the problems in healthcare.
I got a fun fact to leave us on. I think the team member that's helping us produce this connected me with you years ago when I was a guest on your podcast. And she saw the name Healthcare Rap. And I don't know if you know this, Jay, it's rap, like R-A-P. Like he used to do a lot of raps. Mm-hmm. And she was like, you're not allowed to go on that podcast because you're going to embarrass the hell out of yourself.
Probably not the first person that has been told that. The guests are not required to rap, for the record.
Thank you for listening to today's episode of Health Impressions, Authority, Acquisition, Retention. We hope you found the conversation insightful and thought-provoking. If you enjoyed the show, be sure to subscribe on your favorite podcast platform so you never miss an episode. And if you have a moment, please leave us a review. Your feedback will only help us improve the show. If you have any thoughts or questions about today's episode, we'd love to hear from you. You can connect with us on social media, or you can send us an email at media@tidalhealthgroup.com. TIDAL healthgroup.com. Until next time, keep exploring, keep learning, and keep pushing the boundaries of your knowledge. Thank you for tuning in, and we'll see you again soon.